Welcome, everyone. Thank you so much, Dr. Pope, for joining me tonight. We are really looking forward to learning about everything we can do to protect our pelvic floor in pregnancy to help reduce issues in postpartum and in pregnancy, because we all know pregnancy isn't the easiest on our bodies, especially our pelvic floor and our abs. So I am so excited to have you here tonight to be able to talk us through some of the things that we can work on proactively. My name is Jessie Sletton. I am a postpartum coach, and I just love working with folks that are pregnant and newly postpartum to help bring ease and joy into this time frame so that you can be present and enjoy your newborn. And with me tonight is Dr. Rachel Pope. Thank you so much again, Rachel, for joining. If you'd like to tell us a little bit about yourself, we'd love to get to know you.
Sure. Thanks so much for having me. I'm really excited to be here tonight. This is a great opportunity to talk about the things that are special to me, but also to share with other moms. I am a mom of soon to be 4 kids. I'm about 6.5 months pregnant with my 4th. And I've been a PT for, I guess, a little over 16 years now. I've been working mostly in the orthopedic space for a long time. I really kind of got into the women's health and wellness when I was pregnant with my second, actually. So 3 babies ago, because I was dealing with my own pelvic floor and pain, pelvic girdle pain and SI joint and back pain and that sort of thing. So it's really kind of pushed me into this arena. And so now I'm actually a pregnancy and postpartum corrective exercise specialist. So this is what I help moms do. So working in pregnancy, working in postpartum, let's get your pelvic floor functioning optimally so that you feel your best in pregnancy and that your recovery postpartum is optimal as well. Because I meet a lot of moms who struggle, myself included, and this is one of the reasons I got into this work, with getting back to, normal, whatever that is for you. I've been a runner for as long as I've been a PT, and that was my biggest hangup, was that I couldn't get back to running in the way that I wanted to after I had my second. And it took me a good year and a half to feel good in my body again. And that is just way too long. And I meet a lot of moms who have gone even longer than that, dealing with pelvic floor issues. And when we talk about pelvic floor issues or symptoms, we're talking about things like leaking or incontinence. We're talking about abdominal separation. We're talking about pelvic organ prolapse, or any sort of pain that also develops in pregnancy and postpartum. So in the pelvis, in the hips, in the back, including even in the knees and in the feet. So all of those things can be related to the pelvic floor, believe it or not. Just like how you stand can be related to how your pelvic floor is functioning. So I got into this area. And then after I had my 3rd baby, after I had done all the research and everything, because I actually was not getting a lot of help from the medical community myself, which was really, really frustrating, especially being in it, on my own, no help from my coworkers, no help from my OB, and everybody was just like, well, this is just kind of how it is. And I'm like, you know what, this is not how it is. And I think a lot of moms get into that place where they get this kind of pushback from the medical community of well, you just had a baby and that's just kind of how it is. And that's just not an acceptable answer to me. So anyway, long story long, which I like to say, because I usually say long story short, and it's never short. I had my 3rd baby. I was able to start back running at 3.5 months, and I felt so much better. So now this is what I teach moms. So if you want to get back to running, if you want to get back to any sort of exercise, really high impact activity, lifting, some moms just want to be able to go for a walk with their kids, or be able to sit on the floor and play with their kids, or pick up their toddler without leaking, or laugh and sneeze without having to worry about wearing a pad. So those are the things that I help moms with.
I love that so much. And I feel like so many of us in this field, the postpartum and pregnancy realm, no matter how we interact with that, I feel like so many folks that I've talked to, it all stems from personal experience and not being satisfied with our own experiences and wanting to make that change. Right. And I think that that's so powerful, because you've been in this situation, you've walked the walk, and now you've come out the other side and you have the answers to helping others. And I think that's really beautiful. And thank you for coming and being willing to share your knowledge with us. I think this is going to be super helpful for our community here, no matter where you are, whether you're pregnant or you're even a year out of, postpartum. I love to say it's never too late to get that help. No matter where, whether it's your pelvic floor issues, whether it's your, breastfeeding issues, whatever that is, seek out the help. There is help out there. You just have to be able to be a part of communities like this, where that support is educated, evidence-based, and it will get you what you need. Because yes, so many people that I talk to that have had really bad experiences with the medical community, those people who are supposed to be there for you, and they just aren't educated enough in this specific demographic of people. And there's a lot of us out there that are pregnant or postpartum. So It's frustrating that it's not catching up. But we're lucky to have folks like you who are educated in that specifically. So let's dive in. Tonight, we were going to talk specifically about how we can protect our pelvic floor in pregnancy to reduce those issues postpartum, and kind of how we can really manage or understand what our body's going through and being able to check in on some of those shifts and changes. Is this in the normal range? Is this where we have to start, getting some therapies involved in those kind of things. So I'm going to let you take the floor and just impart your wisdom, and I might interject with some questions, but you're the expert here. So thank you so much.
Sure. So there's a few things that I can sort of blanket that would be helpful for the pelvic floor. And then I might break it down into sort of different things that you're dealing with. So like diastasis recti, right? So that's ab separation, leaking or incontinence, and then like pelvic organ prolapse. The pain category, that is, in the pelvic girdle or in the back or the knees or the hips, that one's can be addressed through some of the things that I'll talk about here. But if you're having specific pains, that really warrants more of a individualized evaluation by a PT or someone who's trained in this field to really give you some targeted exercises. But in general, so the main things really to protect your pelvic floor, and this is going to sound funny, but I'm not going to actually be talking about your pelvic floor. Okay. So things that our pelvic floor is just connected to so many other parts of our body. The first thing is your posture. Okay. And so this comes up a lot. I would say I talk to probably 98% of my clientele and my patients, regardless of what they come to see me for, about their posture. And I am guilty as well. Posture can be a hard thing to work on, especially when you're tired and you're fatigued and it's the end of the day. Sometimes it just feels like gravity is just like pulling you down, and it's really hard to like sit up straight. And as you can see, I was just slouching right there. So in pregnancy, right, our body goes through a lot of changes to accommodate the growing baby. And so some of those changes are that our rib cage expands, right? So as our belly gets bigger and baby takes up more space, our rib cage has to expand and accommodate that. So a lot of times what happens is the mid back gets very tight and stiff, right? So sort of that area between the shoulder blades, sort of like just above the bra line area, gets very, very tight and stiff. And then add on just you're carrying extra weight in the front. Your breasts are a lot of times getting bigger too. So, right. So that everything is just sort of pulling you down in this forward direction. So working on your posture, it can be as simple as like setting reminders for yourself throughout the day, or just sort of checking in with how you're sitting, how you're standing, how you're moving, and sitting up straight. Now, sometimes there's a larger issue underneath that. So maybe you have some weakness, right, in your shoulder blade area. Maybe you have tightness in your low back. And so when you try to sit up straight, there's some discomfort or pain. And so you're sort of fighting against your body on it, on its own. So just working on your posture, is helpful in and of itself. If you're finding like, I kind of get into that position, but I can't really stay there for very long, then that's an indication that you probably need to do some strength and endurance training. Okay. another change that occurs, which I kind of touched on, is like the low back, right? So because our bellies are getting bigger in pregnancy, that whole weight kind of pulls the belly forward. And so our spinal curves actually become more pronounced, if you will. So like our spine has a nice S curve to it, right? So a lot of times what happens is our head comes forward. And so the S in our neck becomes a little bit more pronounced. And then our belly kind of pulls forward. And so that S in our low back becomes a little bit more pronounced. So again, working on your posture, centering your head, head over your shoulders, just like very simple things, but they can be kind of a challenge to do when you're pregnant. As far as the low back is concerned, we can still work our core muscles. We can still work our abdominals in a safe way when we're pregnant, and tightening or contracting our deep abdominal muscles. And I don't know how deeply you want me to get into this, but I can get all geeked out on the names of the muscles and everything, but if you're interested, right, your transverse abdominis is kind of the muscle that sort of holds everything together, and it's kind of like that corset muscle around the body that connects from the back all the way to the front. And so even when we're pregnant, we can contract that muscle. So when you tighten your belly, it's kind of like hugging your baby up towards yourself. So as you sort of tighten in your belly kind of gets a little bit smaller and kind of moves up towards your heart. So kind of like hugging your baby to your heart. And that can actually help protect your low back. So like if you're standing and doing the dishes, let's say, right, that can be a time where your back or your neck are bothering you. So kind of tightening in through the belly can help with that. So that's just a simple technique to work on your posture. Okay.
I love that.
Yeah.
And I love that it's hugging the baby to your heart. I think that's such a good way to remember that. And it's like, that's nice.
I mean, we can't be on like that, like 100% of the time.
Yeah.
But it's actually a good exercise that you can do either in standing or sitting, and it'll actually help strengthen those muscles, those postural muscles, and give your core some more support. So it's a really great and simple exercise for your posture and just for your overall like muscle integrity, while you're pregnant. The other thing that I was going to mention, I talked about sort of that mid back tightness and the ribs expanding. So a lot of times, when you're pregnant, you kind of notice like, not only is my cup size for my bra getting bigger, but my band size is getting bigger too, right? And that's because the ribs are expanding. A lot of times what happens then in postpartum is that the ribs stay stuck open, right? And so moms will say, well, my band size just never changed. And we can work on that. We can do exercises to kind of bring things back down. But what you can do when you're pregnant, and this is another just like simple thing, but for a second, if you want to just kind of do this sort of exercise with me, is if you just kind of close your eyes for a moment and then just take a deep breath in. And then just notice, like, don't try to change anything. Just notice like where your breath is coming from. Like what part of your body is moving? Like, is your chest moving? Is your belly moving? Is your back moving at all? Are your sides moving at all? Okay. So those would kind of be the check-in points right there. And so you may find, if you tried that little thing, a lot of women are very shallow breathers. So we breathe mostly from the chest. And I think that's a lot of times that comes from our societal norms of wanting to have our bodies look a certain way and kind of like holding our belly in. So we just breathe all from our upper chest, which is not great for that back tightness that I just mentioned. So we are a 360-degree being. So we should be breathing in 360 degrees. So when we take a deep inhale, right, we should have the chest and the belly expand. We should also have the ribs expand from the sides. And you can even just do this in sitting too, is just putting hands sort of on your ribs. And as you breathe in, I don't know if you can see that, but my hand sort of comes out to the side, and then as you exhale, everything sort of comes back down and in. So it's kind of a really, and your back should expand too. So you can even do like a hand on your back to breathe in and breathe out. You can do it in sitting. You can do it lying down. It's also just a great relaxation kind of exercise to do. But what's really cool about that is that by working on our breathing, we're actually mobilizing the spine. because when we breathe in, right, our ribs expand and they come down, right? And so those ribs are connected to the spine, right? So we're basically mobilizing the back when we do that type of exercise. So working on breathing goes hand in hand with working on your posture. And those things can help with your pelvic floor function. In that, and let me tie this into the pelvic floor now. Is my pace of speaking okay? Are we? So what happens is if, let's say, like I have a diastasis, I have an ab separation. I have essentially had it since after my first. It's definitely now at 6.5 months, I can feel it like it's opening more. That's through no fault of our own. It just happens. Studies show that 100% of women have some sort of ab separation at the time of delivery. Okay, so it's just our bodies have to accommodate a growing baby. It's just what happens. Now, the problem is when it becomes a problem. So when we develop issues related to that. Now, when we talk about posture, right, if we're sitting or standing more upright and we're breathing appropriately, then all the pressure is not going towards the front of the body, towards the front of the belly, right? So if we happen to be like a chest breather, or we kind of hold the belly, if we hold the belly in, the air can't get to where it needs to go. So we're only expanding in one part of our body. So what happens is that sometimes women will bear down and push down. If you slouch down too, that kind of puts more pressure. I mean, if you just slouch down, like what happens to your belly, right? Kind of pooches out a little bit, right? So you're getting more pressure at that center line. And so what wants to happen there is that those abs just want to separate more, right? So posture, breathing, getting air everywhere where it should be going and not just to the front of the body can help protect we can't prevent, what I should say is we can't prevent the diastasis from happening. What we can potentially prevent, and there's not a lot of research, there's actually no research to back this up, but just from clinical experience of other PTs in this area have shown that by working with moms, we can actually prevent the severity of the diastasis. And we can also affect how quickly that diastasis closes after delivery, just by working on posture and breathing. I mean, it's simple, but it's effective. You know, there have been moms who have a less of a gap after a subsequent pregnancy and less recovery time to get those abs back together in a subsequent pregnancy when they do these things while they're pregnant, which is really, really cool.
Yeah, that's powerful. And I think that sometimes we overlook the simplistic answers and we're looking for a more complicated answer, but why not try to take advantage of these things that are simple to do when you are tired and you are uncomfortable and all of these things, and it ends up helping you feel better too in the process. And I love that you mentioned breath work. That is so powerful in so many ways. And that's one of the things that I work with my clients on for grounding techniques and just being present when they're feeling overwhelmed, anxiety, breathing and calming down the nervous system. It's also connected. So breath work is an incredible tool across the board. So I love that you mentioned that.
Absolutely.
Sure. I'm just double checking to make sure we didn't have anybody join and have questions, but I don't see any questions. So I think we're good.
Okay. So I guess I can talk a little bit about pelvic organ prolapse, right? So a lot of times we just call it prolapse. And basically, for those who are not familiar with that, it's basically the organs of the pelvis start to descend into the vaginal canal. So that can either be the bladder, the rectum, or the uterus itself. And it's graded by stages. You have to be sort of diagnosed by a doctor, but a lot of times what women will say is like, it feels like like when you're pregnant, it feels like the baby's right there and you're nowhere near delivery. You just have that like fullness or that heaviness feeling. And your risk of prolapse is actually higher in pregnancy than it is in postpartum, which is interesting because you don't hear a lot. Actually, I should say, I don't hear a lot about it sort of in this arena or with other moms about developing it during pregnancy. You often hear about it more afterwards in the postpartum period. So, so again, working on posture, working on breathing can help because again, we're not sort of squishing that canister down, right? We're not squishing the body down and pressing on the pelvic floor. The more we press on the pelvic floor, right, then that's just more pressure. And so the pelvic floor is more susceptible to developing that prolapse. We also have the weight of the baby too. So that's, I don't want to say that's not helpful, but I mean, that is one of the factors that plays a role as well. It's just that you have the weight of the baby on your pelvic floor. So you are at risk for that. A lot of moms think, well, I'm planning on having a cesarean, or I had a cesarean. And so, I don't have to worry about my pelvic floor, but really, your pelvic floor has been affected for the last 9-ish months of carrying a baby. So there is still a risk for that. So besides working on breathing and posture, which are fantastic things to work on, the other big risk factor is constipation, which is not a fun topic to talk about, but so any sort of like bearing down, right? So even if it's postural, you're kind of pushing down. If you're bearing down at all, like some women find that they are always in sort of a state of like lightly bearing down. And that can even be when you're like lifting the groceries out of the car or picking up your toddler or your older child. But even, with constipation, right, you're bearing down. So what you want to try to avoid is that from happening. So making sure that you're, diet stuff, like making sure you're drinking plenty of water, making sure that you are taking in foods that help decrease constipation. So fiber rich foods, things like blueberries, coconut water is really great because it has magnesium in it. Magnesium can help with constipation as well. And then also just like, it sounds funny, but your posture and positioning when you are using the bathroom. So a squatty potty, like, I don't know if you've heard of that or if anybody has heard of that, but basically that positions you in a better alignment, if you will, so that it's more comfortable and it's actually more anatomically correct for your body to be able to go more easily. So really you shouldn't be like, the more bearing down, the worse it is for your pelvic floor. So do what you can as far as like diet's concerned to try to eliminate that factor.
Yes, I love that. That's definitely, as a nutrition coach, as part of my package. And I definitely like preach about the fibers and even like bone broth is really great for constipation problems and for so many other things too. And chia seeds and just so many things that you can do to get creative, especially when you're pregnant, when certain things might not sound good to you or whatever. There's definitely ways that you can kind of get that in. So I love that you added that. That's really important. And it isn't a fun topic, but it's a very prevalent one that needs to be discussed.
Absolutely.
Yeah, for sure. Well, that's awesome. Yes.
And so like the last sort of category I wanted to talk about was leaking. So a lot of moms will deal with either in pregnancy or in postpartum. Personally, I've dealt with it mostly postpartum just because everything's already just been like, your core has been sort of stretched out, your pelvic floor has as well after delivery. And so for a lot of moms, it just self-resolves within a couple of weeks postpartum. But some moms develop it during pregnancy. And again, that's just because of the weight of the baby on the pelvic floor. So your pelvic floor has to work harder in pregnancy when you exert force. So coughing, laughing, sneezing, if you're still exercising, if you're doing any sort of impact activity, even just like chasing after your kids, right? You run for a short distance. You don't have to be a quote unquote runner per se, but even just, a short distance, like run across the parking lot or the street or whatever, that's more impact. And so that's your pelvic floor has to be able to support the weight of the baby and then the impact or the force of the cough, the sneeze, the laugh, etc. So you can address this during pregnancy. This is something that might need a little bit more guidance from a professional, depending on kind of where you're at and what your exact symptoms are. But you can, and this is not the answer to everything, which a lot of times women think that it is Kegels. So just contract. A Kegel is basically a pelvic floor contraction, right? So it's just sort of tightening the pelvic floor as if you were going to stop a stream of urine. And so if a lot of times during pregnancy, this is a sign of weakness. Leaking is a sign of weakness. However, leaking can also be a sign of an overactive or a tight pelvic floor too. So this is where you might need a little bit more specific guidance from somebody based on what you're going through. So as long as you don't have pelvic floor tightness, or as long as doing Kegels doesn't create pelvic floor tightness, then you can certainly work on doing some Kegels in pregnancy to try to work on some of that leaking that you might be experiencing. So this is kind of one of those, like, you could try it. It might not work. Sometimes Kegels make your symptoms worse. And then that's like kind of like a self-diagnosis of like, oh, I guess my pelvic floor is either is tight or it's getting tighter by me doing the Kegels. So this is kind of one of those, like I said, one of those areas that might need a little bit more personalized guidance, because leaking can be a sign of overactive or underactive pelvic floor.
So interesting. I guess I never really made that connection that it could be an overactive pelvic floor. Do you think that that is less common than the weaker pelvic floor that you see, like clinically, when you work with?
In the area that I work with women who exercise quite a bit, and especially runners, tend to have a tight pelvic floor. So it's actually more the tightness rather than the weakness or the underactivity. Just because the muscles just tend to just in general just be stronger and tighter. I mean, runners deal with a lot of like tightness issues as well. So you know, everything's all connected, the abs, the hips, hip muscles, and everything's all connected to the pelvic floor. So so a lot of times it is the overactivity or the tightness of the pelvic floor. And I don't know what the exact statistics are of like, under versus overactive and you know, contributing to the leaking, but you know, having an evaluation would be able to kind of determine that for you.
Yeah, that's awesome. That's really informative. I had no idea about that. That's great. Well, awesome. Thank you so much for going over those three areas. I think that was really helpful. Just want to double check, make sure. I'm seeing like hearts and stuff. So I know I have people with us, but it's just so frustrating. Sometimes Facebook doesn't show me comments. So I'm not seeing any, but we can go back in and check afterward to see if there were questions. But I do know that we've had a few people join because I'm seeing reactions, which is great. So if you do have any questions, if you're here live with us, feel free to drop those below and I can monitor those continuously as we kind of wrap things up. If not, we'll go back and we'll answer those, especially if you're watching the replay. But I'd love to just leave with, how can our community get in touch with you? How is there ways that they can work with you if that's something that they feel like they need?
Sure. So I'm mostly on Facebook. So you can just find me by Rachel Pope on Facebook. I post a combination of pelvic floor related stuff and then a lot of stuff with my kids. So you'll see a lot of family stuff on my page as well. But just send me a message on Facebook. I'm also on Instagram. So I know some people prefer one over the other. On Instagram, I'm at rachelpope.pt. And then if you'd like to kind of take a peek at my programs that I offer, the coaching and physical therapy that I do. So I do PT, physical therapy, for all my services are virtual. I should preface by saying that. So I can see physical therapy clients who reside in the state of Vermont or Connecticut. That's where I'm licensed. But coaching I can do sort of for anybody, anywhere. So that's location independent. But you can take a peek at my website, which is rachelpope.co. Okay, there's no M at the end. It's rachelpope.co. And so you can get a sense of kind of a little bit more about my background and the programs that I offer. I primarily work with runners and exercisers, but I also have a special place in my heart for those who have had SPD or pelvic girdle pain, because that's what I've kind of dealt with myself. If you're having any sort of pain whatsoever, you're having any sort of leaking or prolapse or anything that we talked about, these are just sort of general guidelines, but sometimes it's hard to decipher, like, well, what's the best exercise for me, or what should I be doing on my own? I'd be happy to, schedule something with you and then sort of take it from there. So those are kind of the best ways to connect with me. I do have a Facebook group. If I could throw that out there, it's called Running Community for Moms. You don't necessarily have to be a runner to be in there, although I do post a lot of stuff about running. I have extensive trainings in there as well, just on like pelvic floor health in pregnancy and postpartum as well. So if you're interested in that, you can head over, and the link is in my bio on Facebook as well. So you can just kind of join in through there and get access to me that way as well.
Awesome. Well, thank you so much. We'll get all of the socials that Rachel just listed off to you all. I'll input that as a comment below so that you can have easy access to that, easy access to Rachel. And she's also in this group as well. So, you can find her that way easily. But we are just so thankful that you have taken the time to just teach us all of these amazing things. This is just the tip of the iceberg. I'm sure it's very generalized. So I highly recommend you reach out to Rachel if you are experiencing any of those things she talked about, and just get the help that you need. It's never too late to get the help. It's never too early to get the help. It's also great to be proactive about these things. So Rachel shared some really great tips with that, kind of DIY on your own. And then if you need that more one-on-one, more guidance, which I highly recommend with so much in postpartum and in pregnancy, go ahead and prioritize that for yourself, because you're worth it. Your health is worth it. It will make so many things easier on you down the line, pregnancy and postpartum, as far as your healing goes. Thank you so much, Rachel. This has been so fun. We've had several people join, so I will continue to monitor for the comments in the replay and get people connected if they need that. And otherwise, I just appreciate your time. I know it's late, so thank you for joining so late where you are. And I look forward to maybe bringing you back into the group. Maybe we can talk about some other topics later on. You mentioned SPD. I know that is a topic that a lot of people are dealing with. So maybe that's something that we can bring you back in for at another time.
Sure. Awesome. Thanks so much for having me. I really enjoyed this. And yeah, I'd love to pop in here again. Yeah, if there's specific questions that come up too, either now or in the replay, just tag me so that I see the question, and then I can pop in and try to answer that either in the comments, or if you need a little more specific guidance, then I can always message you too if it needs that.
Awesome. Thank you so much, Rachel. All right, everybody. Thank you for those who joined us live. If you're catching the replay, let us know if you have questions, what you thought, what your big takeaways are. We'd love to hear that feedback as well. Everybody have a great night. Thanks, Rachel.
Bye-bye.
Bye.